And there are fresh concerns over the resumption of schools in the country.
The Presidential Task Force raised these concerns during its briefing in Abuja. The PTF advised state governments to reopen schools with caution, stating that there might be a spike if pupils are allowed to resume without adequate preparation.
Meantime, the Academic Staff Union of Universities have kicked against the reopening of public universities. ASU says that most public universities do not have the facilities required to comply with COVID-19 protocols. Joining us in the studio to discuss this is Public Affairs Analyst Bola Oba. Bola, good morning. Nice to see you.
Pleasure to be on your set again.
Great. It's quite a while, exactly.
COVID-19 era.
All right. Now, we're glad to have you join us. Now, I know you've been following the development of schools to resume, no, don't resume, okay, no, resume, no, don't resume yet, you know, and all of that. What concerns do you really have? Because as at this time, there are so many, we remember the government handed that decision to states to decide, but ensure that some protocols are, you know, put in place within schools. But now the PTF is saying, well, take caution, let's not rush into resuming schools.
Let's get some scientific facts right. Because we're talking about the scientific phenomenon here. Science, enormous amount of scientific evidences across the world by respectable scientific communities have established the fact that people below the age of 18 are 1 in 3 times or are less to be affected. That is, they are potentially not as vulnerable as people in their 40s, their 50s, and 60s. It has also been established that 10 years and below are 1 in 1,000 likely to be affected, be symptomatic, and even die. 1 in 1,000. So if we say the window of 1 in 10 years, primary school essentially, Abi, utterly, and children are usually most inclined to spread viral infections like flu. But this particular virus, this novel virus, has been so kind to youngsters relatively. So, and below 18, that is up to secondary school, there's likelihood that the rate of infection is lower. That is science. Now, if we've established that scientific fact, let's establish the socioeconomic or sociological fact that we can this thing. Because of COVID-19 globally, it has been established across the world, especially in developing nations and in countries like Nigeria, that school-age children, especially female, have been reduced to go into early marriages and forced labor, male and female. But female, more early marriages. We know that some immunization programs take place in school. So because of the closure of schools worldwide, children are said to be now more vulnerable to some other diseases.
Because they are missing the immunization.
Because they are missing the immunization regime. You would remember that it was in Mushi in those days that I got my own.
Yeah.
I got
mine.
He left a scar somewhere on my.
There's always a scar.
There's always a scar. It shouldn't have been always a scar. But you know, maybe we were handled by some frustrated
health workers.
So, all said and done, I'm sitting here now thinking, we are largely being failed now in Nigeria, and we've seen across the world that schools are beginning to resume. We are largely being failed in Nigeria by the seeming irresponsibility of most of our governments, federal and the subnational governments. Why am I saying this? What does it take to make provision for water in a school? Because essentially, the most strategic element that could be used to reduce the potency of the virus, apart from people using face mask and face shield, which we could provide for our children, would be the availability of water for hand cleansing. If any government cannot do that in Nigeria, one wonders.
All right, so if we get you correctly, you are on the side of schools reopening.
My sister, given the sociological, the socioeconomic disadvantages that have been already established to have been inflicted by this malady on children, on school-age children, I am one who is thinking that because of the peculiar situation of Africa and Nigeria, we may be enhancing the potential recruits for Boko Haram for the next 10 years.
Yeah, but the point there is you just also agree to the fact that a lot of these protocols, things that are supposed to be on ground, have not been provided.
Yeah.
So if they are not provided, wouldn't that be
open them
endangering
to
the
danger?
children?
Yeah.
Fantastic. I was talking to a friend of mine yesterday. I said, I respect a teacher. But when a teacher comes into a union, I am always very careful, like the ASUs of this world, the NUTs of this world. Unionism has its own fundamental problem. Their demands will always be tilted to, but I am saying that fundamentally, at this juncture, we need to be talking to the governments that they are the ones failing us.
All right.
But you know what? The demands of the teachers too need to be reasonable.
Okay. Anyway, let's look at the issue at hand now, talking about the concerns for the resumption of schools. As much as a lot of parents are calling for the resumption of schools, because we've seen situations where parents are frustrated and now transferring that on their children, there is also the situation of schools, especially public schools, not having enough capacity. When you look at the number, observing all the protocols, and ensuring the safety of students, you would recall that certain pupils were said to have tested positive even during this WAEC exams that are being written. How do we strike a balance at this point? Because you looking at the mind, the mental state of students who are crying, our parents are frustrated and are transferring that to us. The school's capacity, government's not yet doing enough, as it has been said. Where do we go from here?
It is very disturbing that we have governments that are failing big time to live up to their responsibilities. We have seen scientific evidences speaking to the fact that when people are properly masked and when people are properly shielded from being vectors, and we've seen societies, Taiwan never locked down for a day, and yet Taiwan has one of the lowest rates of infections because of the massive adherence to using shield. If the government cannot even provide water, basic water, you can imagine the value chain of productivity that would have gone into providing water in all public schools. The people who will dig the ground will be employed. And apart from that, the socioeconomic value of providing water, because apart from the children who will need the water for the hygiene that should be kept, the community will benefit. So if we say the government cannot even provide water, the government cannot provide adequate personal protective equipment for school-age children and adolescents, something is wrong with us. Because I want schools to be open. Because like you were rightly opining, just before we came, I wouldn't know if people at home heard it. We've had, by human rights activists like some of my colleagues here, we've had instances of child molestations, especially female this thing. We've also had instances in the Sahel region. I don't have evidence for Nigeria. I must be very circumspect. I've read from the economics. From the Sahel region, we've had instances of girl child being given to marriage because parents are frustrated and they're economically impotent.
So how do we ensure that if we have to reopen schools, the students are safe and also their mental health is balanced? Right now, we need to strike a balance.
Then you have just asked a very beautiful question in a very, very good way. What is the purpose of government in most African countries? What is the purpose of governments in Nigeria? Let me give a typical example. If a state like Lagos gets average of 30 to 35 billion naira every month, is Lagos State telling me that they cannot provide water in virtually all primary and secondary schools owned by government in Lagos? And even incentivize the owners of private schools, incentivize them to provide water, which will not only be good for the hygiene of those who will be on the school compounds and campuses, but will be good for the socioeconomic situation or socioeconomic circumstances of the neighboring communities. Something is fundamental. You have just asked me now, what is the purpose of government? That is why I'm saying that we must not lose sight of the fact that closing schools have enormous socioeconomic, indeed medical, mental health problems. But I can't sit here and be delusional enough to know that the reality is speaking loudly against government, especially when we in the last couple of months have heard about the almost more than $500 billion naira contributed by people, concerned persons and companies, and you wonder where have all those monies gone? Is it palliative? Is it,
okay. but as it is, well, the point there is we are here already. If the government decides now to start providing water, like you said, in all of the schools, it's a major project because it has not been there in some of them, in many of them, like you said. We've not had them all the while. It's going to be a major project that will take a long period of time.
What
so
about,
where do we start from?
What about procurement of PPE? What does it take to buy this from and you know what? I bought this 1,500. Government will come now and say they are buying it for 5,000. We don't even care. But can't you buy those things and make them available? There used to be a government in this state when I was a boy. They gave me books in all the 8 subjects I did.
All right. Let's leave the conversation here now, for our time is up. Bolaoba, thank you so much for speaking.
Thank you very much for the opportunity once again.
Thank you so much.
Thank God I'm ending on the ladder.
Thank you.
On the softer side of life.
You can sleep well now for the rest of the day.
Yes,
Thank you so much. Thank you.